Hello, sahabat JIH. A very warm welcome to today's broadcast hosted by JIH Hospital. I'm Dr. Putu Diah Pratiwi. As your host, I'm a pediatrician right here. Today, we are discussing a very important topic, the silent risk, understanding Brugada syndrome and sudden cardiac death. To help us navigate this, we have two remarkable experts with us. And for a quick backstory, Brugada syndrome was discovered in 1992 by the Brugada brothers. It's all start with medical mystery, start with 3 years old boy experiencing unexpected cardiac arrest, and the Brugada brothers spot a unique electrical flow on his ECG, and that single clue led them to uncover this hidden cardiac genetic syndrome. And joining us from Spain is Dr. Georgia Sarquella Brugada, MD PhD, President of Spanish Society of Pediatric Cardiology from the SGD Barcelona Hospital, as her, and bring us unparalleled and deeply personal expertise to this discussion. As a family known as Brugada Brothers, actually discovered name the Ferry syndrome. We are so privileged to learn from the source today. Welcome, Dr. Georgia. How are you doing today?
Hi, thank you.
Yeah.
So happy to be here.
Yeah, I'm so lucky to meet you here. Thank you for coming. And we also have an incredible privilege to welcome Dr. Oktavia Lilyasari, consultant cardiologist from capital of Jakarta, National Cardiovascular Center Harapan Kita. Thank you, Dr. Oktavia, for joining us today. So today we will start from Dr. Georgia. We will start to understand the foundation of this condition, and then Dr. Oktavia will discuss about the real condition in Indonesia. And Dr. Georgia, maybe I want to ask about the heart attack. Maybe many people are familiar with heart attack, but when it comes to Brugada syndromes, while it may actually be quite common, but maybe many people still unfamiliar with this syndrome. Would you like to explain what is exactly Brugada syndrome is, and why is it considered one of the most important inherited heart rhythm disorder worldwide?
Hi.
Yeah.
So I think it's important because sudden cardiac death can be provoked by many diseases. Some of them are inherited, some of them are acquired, like atherosclerosis and all the consequences of atherosclerosis. And in fact, it's the main number. It's related to this degenerative disease.
Yeah.
But there are certain inherited cardiac diseases which deal either with the electricity of the heart, so channelopathies, or the shape of the heart, which are cardiomyopathies that are related to sudden cardiac death. Specifically, within the channelopathies, there are three, I would say maybe four main syndromes that relate to that, which are long QT syndrome, short QT syndrome, catecholaminergic polymorphic ventricular tachycardia, which is CPVT, and finally Brugada syndrome, which are related to that. What makes Brugada syndrome different from the rest is that mainly it's the form of presentation is during night, at nighttime, while resting in young males, like 40-year-old males. That does not mean that women are out of risk. That also does not mean that children are out of risk, okay? But we see the incidence of the disease, it's quite higher in this population, which is men at their 40s. And this is important. And of course, when thinking about which are the signs or symptoms, sometimes the first sign of the disease is sudden death. So a person without any type of symptoms previously can die of Brugada syndrome. And there are many others that can be palpitation, like dizziness, some types of rare, strange snoring at night, what that we called agonic nocturnal respiration, and finally, of course, syncope, especially with fever. Fever has a very special role in Brugada syndrome and needs to be carefully assessed.
Okay, that's quite interesting. So why this condition often referred as silent killer, and what happened inside the heart during the fatal arrhythmia, and why some patients appear completely healthy for years without any symptoms?
This is an interesting question. In fact, there are people that even their ECG is normal and they have Brugada syndrome. So, in fact, it's very important to see the ECG under certain conditions that try to unmask the typical ECG pattern, which is ST segment elevation in right precordial leads. That's the typical ECG. And sometimes we need to do things to unmask. The most easier one is to do a normal ECG during fever. And sometimes just the fact of doing the ECG during fever, it unmasks the diagnostic pattern. The other is to give sodium channel blocking agents like ashmalin, flecainide, procainamide, that would unmask the disease by giving it in a certain protocol. So these are the ways. The only way to diagnose Brugada syndrome is by seeing the ECG on the typical ECG on mainly right precordial lead.
Oh, okay. But and the most alarming aspect is sometimes the sudden cardiac death is seemingly in healthy people, and how does this happen? And can sudden cardiac death as just the first manifestation of Brugada syndrome when come to the hospital, and so the warning sign that we never ignore, maybe for the patient and family relative, what is the warning sign that we must be never ignore?
Well, certainly it's syncope, and especially syncope with fever, but any type of syncope, but in sometimes palpitations as well. That's so important to do ECGs in patients, in all patients. If they complain of any dizziness, sickness, chest pain, uncomfort, it's very important to do ECGs.
Okay. So, as a pediatrician, maybe I have to ask younger age group. At what age does Brugada syndrome usually apparent, and how often you encounter it in children, and what do you think about the what your perspective about ECG screening program in school age children?
So in children it's much less common than it in adults, but we have to say that there are certain forms of the disease that they are so severe that they appear very early in life, especially sometimes even in fetal life, that we can see arrhythmias in fetal life. So there are certain cases, normally are de novo cases, the ones that don't have a family background, that they may appear at very early stages, and then those are the very tough cases. They are so severe that they appear very early in life. It's a rare condition in children, and we are one of the largest pediatric Brugada syndrome center in Europe, and we have a handful of very severe cases of Brugada. So it's not a very common disease, but of course we have many patients with Brugada syndrome because we are following all the pediatric patients with Brugada syndrome as well.
So as early as like the previous case, like 3 years old,
or even more. We have some fetuses that already present with arrhythmias.
Okay.
Yes.
And how about the ECG screening program that's already worked in Spain, maybe?
Yes, in our area, Catalonia, we have a ECG screening program that it's performed at age 10.
Age and 10 years.
At 10 years of age, and we do this program. We do ECG to everybody, all the kids at 10.
Oh, okay. That's inside the school program. Like that.
Yeah.
Oh, okay. That's interesting. Okay, thank you, Dr. Georgia.
Thank you.
And now let's bring this into the context of Indonesia and look at another vital aspect of cardiac pediatric cardiology. Dr. Oktavia, congenital heart disease is one of the most birth defect worldwide, and how significant this case in Indonesia. And I want to address a major misconception. Maybe many parents assume that baby with congenital heart disease will always look sick, but is it that true, or some children appear completely healthy?
Yeah, I think congenital heart disease is a common problem in the world,
Yeah.
not exception in Indonesia as
Yeah,
well.
yeah.
And the prevalence in globally is 8 up to 10 over 1,000 people. Unfortunately, in our country, during the congenital heart disease awareness this year, we provide one big screening, nationwide screening all around Indonesia, from Aceh to Jayapura, and include 22 cities and 7 districts as well. And we found that the prevalence quite high compared with the worldwide, because we found up 2.14% of the prevalence of congenital heart defect. So if we have a nationwide, the birth rate is about 45,000 per year, more than 45,000 per year babies born with the congenital heart disease in Indonesia.
Okay, good.
So I think it will contribute the higher mortality rate in children all around Indonesia. And a misconception of the parents, I think it's a good thing that sometimes parents think that the children with the heart disease will look very ill person. But
sometimes they look
the baby sometimes still healthy, and they can play with the other friends like a usual normal kids, because I think the symptom of congenital heart disease is very worthwhile. Yes, asymptomatic until the very severe one. So in asymptomatic patients, sometimes maybe only the asymptomatic heart disease with a small defect, or maybe just like a pulmonary stenosis patient. It looks like a healthy baby because it looks like a chubby or something. But in the very severe patient, we can see the cyanotic, the children or baby cannot breathe well and cannot do the normal activity, or sometimes they got a very severe condition such as shock or something. That we can to perform the intervention more earlier.
Okay. So every day maybe you already facing children with structural issue from birth. So what is the advances in diagnosis and treatment have most improved the survival and quality of life of children with congenital heart disease? Can these children have a normal life, go to school, do some sport, or maybe eventually have the family by their own? And how can parents help to protect and optimize their children's health after doing some cardiac intervention or undergoing surgery such as like that?
Yeah, I think early detection is very important. And almost the GP has to aware about the symptom of congenital heart disease. If the patient is going blue, it may be more easier for us. But I think the earliest detection, more earliest, so we can prepare everything. And the early diagnosis can be start from the vital stage. We can perform the ultrasound examination with a fetal echocardiography, so we can deep searching the congenital heart disease in fetal, and also for the cardiac rhythm anomaly as well, since the fetal life. And we can prepare the delivery,
Possible.
etc.
Yeah.
Because sometimes if we have like a critical congenital heart disease, so we can arrange the delivery site, delivery doctor, and we can manage all the things that prepare the baby born, and maybe we can have some do intervention early after birth, such as doing a prostaglandin or percutaneous pacemaker for total FA block patient, etc. And for the second question, I forgot.
Yeah,
But-
after we do a better treatment
Okay.
and do earlier screening, maybe the outcome is better, and then they can live like a normal kids,
Yes.
do some sport. And
Even children with congenital heart disease, I think they can go to school and
Yeah.
do the normal activity, but not for competitive sport.
okay, yes,
And it depends on the congenital heart defects itself. Is it a simple one or it is a complex one? Because in the complex one, sometimes the children suffer heart failure and fatigue or something else. So maybe we can give them some limitation to the activity, and we can tell to the teacher at school that maybe they cannot afford the sport activity during their school
life,
age.
yeah.
Yes. And for after the intervention itself, in simple congenital heart disease, it can be like a normal one. So they can do anything just like a normal people doing. But in some cases, such as in a univentricular heart repair or in staging state of the intervention, they might be still has a limitation for his life.
Mm.
And I think we also have some patient growing up to adulthood, and they can doing marriage and
Yeah.
having children as
Yeah.
well. It depends on the congenital heart defects itself.
As earlier as we detect it and then treat it
Yes.
properly, and then the outcome
The
is
more earlier, it's better.
better. Okay. So, Dr. Julia, let's move with the diagnosis and treatment. Returning to the hidden electrical flow of Brugada syndrome, how is it definitely diagnosed based on your previous explanation? And can standard ECG, that you said before, always detect it? And can sudden cardiac death from this syndrome truly be prevented? What we can do to prevent if we maybe find it the unique electrical flow on this ECG.
Okay, so the only way to diagnose a Brugada syndrome is to have the type 1 Brugada pattern on the ECG. So having what the so-called type 2 or type 3, this is not diagnostic of Brugada syndrome, only type 1. So if you have a type 2 or type 3 in a suspected patient, you need to perform something to get into type 1. Otherwise, you are not a type 2 Brugada, no. You cannot be a type 2 Brugada. You have something that recalls you and tells you that you have to do something else. And those tests are to perform either an ECG during fever that can turn into type 1. And when we want to get the most of the ECG, instead of putting the leads on the normal place, we try to get the most of it by putting all the 6 precordial leads on the next to the sternum. That we increase the diagnostic yield of the ECG for that. One thing. Second, by performing ECG during fever, it's going to be good. So it's in those patients we don't have the diagnostic yet. If we convince the family to go and do ECGs during fever, that can be very helpful. Okay. To try to see this type 1 ECG, which can be easy. And sometimes by the recovery phase, after an exercise test, treadmill test, on the recovery phase, sometimes we see the pattern as well. So these are different ways to try to take the most of the ECG. Then, otherwise, we use provocative drugs sodium channel blocking drugs in order to unmask that artificially, let's say. These are very good tests, and we like it. There are other currents that may say that they don't do it that easily. We do it very easily, even in children. And finally, the only thing that has proven improvement of the prognostic is the implantation of an ICD. But not everyone needs an ICD. Only high-risk cases need an ICD. Otherwise, the risk of carrying an ICD and having complications of the ICD in a patient who's low risk, the risks of the ICD are greater than the risk of the disease itself. And then you have all the, I would say, the consequences of having an ICD, which no one is free of them, of course. Which now we have new devices that may be implanted outside of the heart, and they will decrease the number of complications. They are the extravascular devices, either subcutaneous or extravascular ICDs, that help to decrease the number of complications related to the ICD implantation. But not everybody needs an ICD. That's very, very important. Only very few patients need ICDs.
Okay, thank you, Dr. Georgia, and that's most important point, for parents to hear, maybe the screening and then the how to diagnose. And Dr. Oktavia, maybe what are the early signs of congenital heart disease that parents should actually be aware during infancy and childhood? What are some defects detected immediately after birth, and while others remain undiagnosed for years? How important is early diagnosing in determine the outcome? As you mentioned before, that's the most important thing is we have to maybe ultrasound regularly while on the trimester 3, like that. Why some case at the first not detected after birth?
Yeah, for the symptom first. The symptoms. Maybe the infant, baby, and teenage is not really the same. So the symptom first is the color.
Yeah.
You can see from the color, because the congenital heart disease has two
The
big classification.
Yeah.
First is cyanotic. It means the baby or the child become blue.
Yeah.
And the second one is non-cyanotic heart disease. And the second one is the breath. Yeah, because maybe some patient has a difficulty of breathing.
Yeah.
So in infant, sometimes we found that only tachypnea, the
As a sign.
fast breathing, and also maybe they can see the from the, we call it the napas cuping hidung,
Yeah.
and then the protection of the chest, etc. And sometimes the baby come with the failure sign, such as they tend to prefer to be, what do we call it, gendong, yes, compared with the sleep with the flat one. Yeah, and baby still crying when the flat one, but it will be more comfort with the gendong.
Oh yeah.
We can call it. Yes.
Yeah.
Yes, and the second one for the pediatrician, maybe you can hear the murmur.
Yeah.
They can hear the murmur. So this is the sign.
Yeah.
It should be something happen with the heart. And the fourth one is a peripheral issue. You can see whether the cold extremity, fast heartbeat, and very low blood pressure. So it may be sign of shock of the patient, because sometimes in congenital heart disease with the duct dependent
Yes.
circulatory systemic circulation, they might be has a symptom with this shock. And for the children, maybe there is some lack of the activities. They feel fatigue with the very small activities, something like that. Failure to thrive because they cannot grow. Just like another
in the normal curve.
Normal curve, yes, and also development failure as well, and also maybe there's something else, the one that has a recurrent respiratory tract infection as well for the children.
So as earlier as we detect it, on the childhood. That's the
Yeah,
outcome.
so
is
I think it's doing the early
Maybe
detection more
yeah,
with the echocardiography and other imaging modality is very important. So we can do the intervention more earlier to this kind of patient.
yeah. Thank you, Dr. Oktavia. And maybe before we finish, I have more personal question to both of you. Maybe for Dr. Oktavia, dealing with this young patient, maybe incredibly rewarding, but also difficult. What challenges do families of children with congenital heart disease commonly face in Indonesia, and how can healthcare provider can help them?
Okay, the most the most important message from me is that congenital heart disease is treatable. So it has to be
Detection.
in mind of the
Okay.
family first, the parents still.
Yeah.
So early detection is very important, even from the fetal, newborn, and also from the infant states.
Yeah.
And the parent with the congenital heart defect patient should aware that the patient has to be sent to the doctor earlier because in Indonesia the mindset of the family think that my child is very small age,
Yeah.
so just let them grow up first and then we do the intervention later. But sometimes it's too late.
yes.
Sometimes it's too late. And for the patient that already got the intervention for the children, it is not the end. They have to do the regularly visit to the doctor. Even they already perform surgical, because sometimes in congenital heart disease, the surgical is not the end of the things. They still have another complication after the operation. So the regular visit and encourage the children to took some medication is a important issue.
Yeah.
Teenage in Indonesia sometimes boring to take the medicine.
regularly.
Yes.
Yeah, just keep the medicine in below the pillow,
Oh, okay.
so the mother doesn't know that he doesn't.
Oh,
He doesn't
take
took the
the
medication,
medicine.
and then we got him again with the heart failure or something else.
Yeah.
Yeah.
Okay, thank you, Dr. Oktavia. And Dr. Georgia, your family name is closely associated with Brugada syndrome. What has the journey meant to you personally and professionally? And what motivates you to continue advancing research about this case and patient?
Well, it's not always easy to be at the level of the Brugada brothers, of course.
Yeah.
But I think that my part here was the pediatric part, and I think that to have a whole view of the disease, it was important to pull up the pediatric world on how Brugada syndrome affects the pediatric the children. So I think that, of course, it's not been easy. I would to say, but it's true that it's I think it's I would say a family matter, and it's very important. So I'm proud to be part of it as well.
Yeah. So you regularly advancing some research about this case, or
Yes, of course.
Is it an obligation?
No, it's not. But I do research. Yes.
Okay.
Yes.
That's great. Okay, thank you.
Thank you.
Both. To wrap up, I would like one final message from each of you. Dr. Oktavia, if there is one message you would like every parent to remember about congenital heart disease, what would it be? And considering our broader discussion today that some heart conditions are present from birth, while others may be inherited and remain silent for years, how important is awareness and early cardiac evaluation in protecting children in future life?
Yeah. As I mentioned before, that congenital heart disease is treatable. So everybody, not only the parents, but also the people somewhere from the children itself, should aware about the congenital heart disease symptom. And please send your son or
Okay.
your kid to the expert if you have a symptom
Yeah.
of congenital heart disease. More earlier, more best treatment for them.
Earlier is better.
Earlier is better.
Earlier detection is better. And Dr. Georgia, if there is one message you would like every parent, family member, and healthcare professional to remember about Brugada syndrome, what would it be, and what practical step can people take today to protect themselves?
Well, I would say that any type of syncope, it's of course important to be studied deeply, but I would say general population, despite Brugada syndrome, I encourage everyone to do resuscitation, to take resuscitation lessons, to know how to use an external defibrillator, and because everybody is able to save a life, and I think that's the most important message.
Okay, that's so great. Thank you for those crucial takeaways. Awareness and early screening truly make difference. Thank you, Dr. Georgia Sarquella Brugada and Dr. Oktavia Lilyasari, for sharing your time and expertise with us today. And thank you, everyone, tuning in from JIH Hospital and beyond. I'm Dr. Putu Diah Pratiwi. Recognizing Brugada warning sign can be life-saving. Stay healthy, pay attention to the warning sign, and see you to the next episode. Bye.